My name's Jim Nunley, and I'm an orthopedic foot and ankle surgeon at Duke University. I started working here in 1975. I started doing ankle replacements in 1987, then there was a hiatus until 97, and now we do more than any place in the world. So for people that have ankle problems in particular, we're especially recognized for excellence in the treatment of all disorders of the ankle. There's two types of patients that I find particularly rewarding. One is the sports medicine aspect of foot and ankle, and we treat a lot of high school, collegiate, and professional athletes with injuries that prohibit them from continuing their career. And there's nothing more rewarding than to be able to take these individuals and let them get back to what they really enjoy to do, and in some cases make quite a bit of money. The other group of patients are those patients who have ankle arthritis or any arthritis in the foot. That's a devastating problem. When you have pain when you walk, you're not a happy person for most of your life. And so to be able to take away pain and let people walk comfortably is incredibly rewarding. Most people don't believe it, including my wife, but I knew at the age of 8 I was going to be a physician, and it was because of a pediatrician that was a family friend. And so I never changed my entire time. I always knew I'd be a physician, and then once I got to medical school I knew I'd be a surgeon. And once I saw how good orthopedics was and the ability to make people happy and to get them well quickly, there was no question but that was going to be where I was focused. My favorite part of the job is definitely seeing the patients, talking to the patients, hearing about them, and then seeing how they do and how they respond.